Cat's Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Carter Anderson, and in today's episode, we'll be talking about living with diabetes with family medicine physician assistant Mary Robinson. Before we get started, 2 quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cat's Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. Thanks for joining us again, Mary, for another episode here. This one we're kind of focusing on diabetes and kind of living with it once you have been diagnosed with it. We'll go ahead and kind of jump into our first question here. What is diabetes?
All right, so diabetes in the most basic, simplest form is a chronic condition where your body either is not producing enough insulin to bring down your blood sugars, or your body is making enough insulin, but it's not using it like it's supposed to. And then it causes the blood sugar in your blood to go up, and then we go from there, unfortunately.
I know there's like different types. There's like type 1 and type 2 diabetes. Are those the only 2 types, or are there more than that?
No, it's not that simple.
Not that simple.
No, there's actually several different types. I mean, obviously the 3 we hear the most about is type 1, type 2, and gestational. However, within the type 1 subset, there is 1.5. We have what's called LATA. There's actually monogenetic ones, which is genetically linked. We even have different types of diabetes dependent on if you've had a transplant. If you've had chronic pancreatitis, you're at higher risk of having diabetes due to that. Cystic fibrosis. So no, it is not just type 1 and type 2. There are several different types of diabetes.
I know you just mentioned it there, but like what about gestational diabetes? How is that one kind of different than the others, I guess?
So the big difference from the other ones with gestational diabetes, obviously the big difference is it's during pregnancy. So obviously you have to be pregnant to have gestational diabetes, and it's just in that pregnancy state, your body is just not doing well with bringing down those blood sugars. Once again, just insulin resistance is a huge thing with that. So, and it's something we watch for very closely in any pregnancy, because if it does happen, it can obviously lead to complications as the pregnancy progresses. So that's why we look for it pretty closely.
One of those big indicators and things you want to keep track of. Okay.
Yes.
Are there common symptoms of diabetes kind of across all those different ones that we talked about? And how is someone diagnosed?
So if we want to talk about diagnosis first, that'll probably be the easiest. So to be diagnosed with diabetes, well, one, if you have what we call the common side effects or symptoms, which would be going to the bathroom a lot, being extremely thirsty, feeling hungry all the time like you can't get enough to eat, extreme fatigue, blurred vision, notice that you have cuts or bruises that aren't healing quickly like you think they should. Weight loss, we can see a lot with people, especially with type 1, even though they're eating a lot, but they continue to lose weight. And then sometimes tingling, pain, or numbness in your hands and feet. So those are kind of the common symptoms, if you will. And to be diagnosed with diabetes, it is based off of lab work. There's 4 different ways. The one that is what we call probably the standardized test would be the hemoglobin A1C, which is a blood test that averages your blood sugars over a 3-month period. So anything that is under 5.7 is considered normal. That 5.7 to 6.4 is that prediabetes like we've talked before. And then at 6.5 or higher, you are diagnosed with diabetes. Another way we diagnose diabetes is for anybody who has a fasting blood sugar greater than 126 after fasting for at least 8 hours. That could be considered diabetes. Some people we will do what's called a oral glucose tolerance test, which is when you come into our lab and you get to drink that super sugary drink. And then after 2 hours, if your blood sugar is greater than 200, you have diabetes.
Okay.
Or the other one, unfortunately, that I have had happen several times in the clinic, I have people complaining about these symptoms of I'm super thirsty, I'm super hungry, I'm going to the bathroom all the time. I'll check a random blood sugar and it's over 200. That's diabetes.
There are all these indicators, but it might be something that you're living with and you don't even realize it, right?
Correct.
What are some common complications associated with diabetes, and how can individuals work to prevent them?
When anybody is diagnosed with diabetes, we kind of go over the complications. I mean, some of the information we give, it's really overwhelming, and I 100% get that. But there are things that we are watching for specifically that we want to prevent because it helps with your health. Like I say, you can have some of these things before you're even diagnosed with diabetes, but if you have diabetes, it can make these things worse. So one of the big ones is cardiovascular. So if diabetes is not treated or uncontrolled, you are at high risk for heart failure. you're higher risk for coronary artery disease, abnormal heart rhythms, heart attack. So obviously big scary things.
Right, absolutely.
Another one is chronic kidney disease. And this one doesn't necessarily have any symptoms off the bat. And so what happens with that, and it can happen in other disease processes too, what it means is just over time as your blood sugars are not controlled, then it causes your filtration system in your kidneys, which it does a huge part of filtering our blood on a daily basis. What happens is they're kind of like little tubules, little holes. Those holes get bigger and they let the bigger particles through. So that'd be like red blood cells or protein, which is what we watch for when you have diabetes. We do a test every year for that. And so when that happens, then that decreases the function of your kidneys. And we watch for that very closely because obviously if you have chronic kidney disease, I mean, if it progresses, you could end up on dialysis, which is something we don't want for anybody. Another big thing we talk about is your eyes. So uncontrolled diabetes can cause problems to the blood vessels in your eyes, which can cause what's called retinopathy, can cause edema of your eyes. If it's uncontrolled, retinopathy can actually cause you to go blind, which is scary. Mm-hmm. You're actually at higher risk for cataracts and glaucoma if you have diabetes. And another big thing that we see sometimes with diabetes is it can actually lead to dry eyes as well. Another complication is neuropathy. So that is numbness, tingling, and pain. And that can be in your feet. It can be in your legs. It can be in your hands and your fingers. It's just the nerve endings die at those places, and then that's when you get that sensation. Some people don't even have pain. They'll even say it feels like they're walking on pillows or clouds. It's just puffy, and they can't feel things as well.
Just total lack of sensation because those nerve endings are kind of like burned up, I guess, from...
with the blood sugars. And then having neuropathy then can lead into foot problems. And those can be you have increased calluses on your feet because you're walking differently. Having diabetes, like we've talked before, it affects your cardiovascular, so it can cause poor circulation because of the blood vessels in your legs taking blood to your feet. We have problems with getting ulcers on people's feet, especially if you're walking around barefoot. You can't feel that you step on a rock. It causes a sore or a wound, and that can develop into an ulcer, which is an open wound, which can be very serious, and those can get infected. And unfortunately, if those get infected and we can't get them treated, it can lead to amputation.
Like we talked about earlier, kind of those early symptoms are if a cut or an injury is taking longer to heal, and you get an ulcer on your foot and the blood flow isn't very good, it's going to be a really big issue to try to take care of, I'm sure.
And like I explained to everybody with diabetes, especially when we talk about foot care, is the parts of your body that are the furthest away from your heart are going to be the slowest to heal. So that's why we ask those questions. That's why we want to check and look at your feet, which people get a little bit early. But that's why we want to do it every year, is we're looking for those things to help prevent those problems.
Catch them when they're small, so there's not a big issue.
Yep. So some other things that are out there, I mean, obviously there's some skin problems. If you have diabetes, that you have higher blood sugars that are not controlled well, it can lead to increased risk of bacterial and fungal infections. Some people get what's called acanthus nigrans, which is actually darkening of the skin around your neck, in your armpits, in your groin folds, and it can happen into like your elbow and the back of your knees. And sometimes we can see acanthosis nigrans before you are diagnosed with diabetes because it's a symptom of insulin resistance. Also at risk for like gingivitis, mouth problems, higher risk of hearing loss, stroke, and then the big one that we try to prevent at all costs is what's called diabetic ketoacidosis, is when your blood sugars are so high that an organ failure is the concern. And so we don't ever want that to happen to anybody. Right. Diabetic ketoacidosis is when your blood sugars are running. Everybody's a little bit different, but it's when your blood sugars are higher. I've had people that, they have a blood sugar of 400, but they're symptomatic when they're nauseous, they're sweaty, they're vomiting, and then just increases the risk of ketones in your blood. I mean, we've had people with blood sugars greater than 800 up to 1200 with that. And what we do, we put you in the hospital and we put you on fluids and we put you on an insulin drip to bring those blood sugars down to stop that process. Scary. We don't ever want it.
That sounds like it impacts so many different facets of your life. Like you said, all those complications. It's
Correct.
Not just one little thing, right?
Yes.
It's a system-wide disease for sure.
Correct.
So, as we just talked through with all those complications, this diagnosis can feel a little overwhelming. How does living with diabetes affect people's daily routines?
So yes, having diabetes and learning you have diabetes can be extremely overwhelming. And I completely get it because it's scary. Nobody wants this disease. Nobody wants it. So I always like to tell everybody, it's going to impact your daily routine because we're going to have to make some changes to keep your blood sugars down and to keep you in the best health we can. However, it does not have to rule your life.
Right.
So, as I always like to tell everybody, you have diabetes, you are not diabetes. And no, there are things we can do to help make the process easier. You have your primary providers. We have specialists called diabetic care and education specialists that we can have people see to help kind of go through all of this too. We want to make it as seamless and as easy as possible as we can for everybody. So yeah, 100% overwhelming. It is okay to be completely overwhelmed and mad and angry and scared about it, but that's why you have us. That's why you have your primary provider to help you walk you through all of this.
Right, your partners through those journeys, and then those diabetic educators and people like that can help as well. So,
yes.
Awesome.
Yep.
Why is proper management of blood sugar levels so important?
Just like everything in life, it's all about balance. So if your blood sugars are too high, we're going to have the complications we've talked about. If you have your blood sugars too low, which is sometimes more scary, you're going to have those complications too. And the reason why I want those blood sugars in the middle is we're trying to keep you what we call euglycemic, which means normal blood sugar, because when you are at that euglycemic area, then you are less likely to have those complications. So that's the biggest point. That's why that blood sugar management is so important, is we're trying to prevent those complications down the road.
Either too high or too low. Like you said, the too low is just as scary, if not scarier, than
Yes.
the high blood sugar. So,
no, we don't want it to be too low. I mean, normal blood sugar for somebody who is not diabetic should be, when you're fasting, is between 70 and 100. If you have diabetes, that fasting number, we want it between, if we can get down to 70, great. If we can get it under 100, great. But I want it 130 or less. And after meals, we're looking at less than 150. The goal with anyone who lives with diabetes is to try to keep your blood sugars under 200 as much as possible. But yeah, 70 is that cutoff for the low. Anything below 70 is dangerous.
okay.
If we get too low, what happens is, I mean, unfortunately, the same symptoms of low blood sugar are very similar to high blood sugar. You get sweaty, people get panicky, you can't think clearly, and the lower it goes, you can't fix that. So that's where having your tribe, your providers, your family, your friends, that they know that you have diabetes, because if you have a low, you're going to have to rely on them to help bring your blood sugar up.
Right.
Because if it gets too low and stays low for long enough, then we're looking at brain damage, increases your risk for dementia down the road. We don't want that to happen either.
No, absolutely. How should individuals with diabetes monitor their blood sugar levels? It's obviously very important. What tools or technologies can assist them with this?
Oh, the fun one. So, yes, unfortunately, with diabetes, we need you to check your blood sugars. And nobody likes doing it because the most common tool we have that's the most cost effective is a glucometer. So that is a little machine. You can go buy them right off the shelf at Walmart or at Hy-Vee or even at Rex. And they put test strips into a machine. You poke your finger to get a drop of blood and you put it on the machine and it tells you what your blood sugars are. So when anybody's first diagnosed, the absolute minimum is at least once a day. So if we go that route, then usually with that, I want some fasting blood sugar. So before you eat or drink anything first thing in the morning, so we know where you are coming out of the evening. But then I also like to see what blood sugars are running 2 hours after you eat any meal too, because we need to know if those numbers are at that 150 range or less. Nobody likes doing that because, poking your finger kind of hurts. But as we add medicines, if we notice your blood sugars are running higher, we're going to have you want to check more frequently. So it can be up to 3 to 4 times a day. If you're on insulin, we want to have a fasting, and then we want a blood sugar before you eat every time, because if you are giving insulin, a lot of times that insulin you give before you eat a meal is based on what your blood sugar is. And if you don't know what your blood sugar is and you give insulin, we can run into having lows. But we have other awesome tools too. We have what's called continuous glucose monitors, and they are awesome tools as well.
Cool. What recommendations do you make about nutrition? What's important for people with diabetes to know about this?
So usually one of the first questions I get when anybody's newly diagnosed is, you're going to tell me I can't eat X, Y, or Z. The answer to that is no. I am not going to tell anybody you can't have anything, because it is all about balance. It's all about portion. And so we have that talk. I know we always talk about how carbohydrates or carbs are bad if you have diabetes, but actually you need to have some. You don't want to go completely without. But we want to focus on those healthy lifestyle changes like we've talked before in our other podcasts. So this is where the Mediterranean diet comes in huge. We want to focus on your lean proteins and your fruits and vegetables. We want to start with those first, and then obviously still add in our good fats, some good carbs too. And a lot of it too is going to be based on your likes and wants, your cultural aspect. because, I mean, every culture has a different way of eating. So we'll work within those confines, if you will, to help with the best thing. And unfortunately, too, with diabetes, some foods are going to affect people, others. Like I have some people who can't eat watermelon because it shoots their blood sugars up, but for another person, it does absolutely nothing. We learn those things as we go along, and we kind of go from there.
Right, kind of a case-by-case basis thing about
Correct.
what impacts you the most, and avoid those things or reduce them in moderation. So
we still want you to have joy in your life, and unfortunately in the United States, food is a huge thing. So like I said, we will work with that to help, because we don't want to take things away and make this harder than it has to be.
You're like, I'm not a thief of joy. I just want to moderate and make little changes.
Correct.
And
like I always tell everybody, yes, you can go to a birthday party. Yes, you can have a piece of cake. Not a big piece, a small piece, but then somewhere else in the day, then we're going to have to take away some of the carbohydrate to help balance that out.
Yep. We kind of touched on that nutrition side there. And like Mary said, we've talked about that in a couple previous episodes too. So let's talk about physical activity. Does physical activity have an impact on blood sugar? What recommendations would you make for your patients?
Yes, physical activity, as with anything, is super important. As far as what you want to do for physical activity, that's going to be 100% based on preference and what you can and cannot do. So once again, any activity is better than no activity at all. So if we are not doing any, we want to do some. But big things with activity too is I have patients, I'm really high after I eat dinner. Go for a 10-minute walk. 9 times out of 10, that will help lower your blood sugar. However, on the reverse side, for some people, if they go to work out, it increases your adrenaline. It actually can increase your blood sugars too.
Really?
Yeah. So knowing those things, and once again, that's knowing yourself, knowing what your body's doing, and we can prep for that kind of stuff. So, but yes, activity does not matter. Any type of chronic health or any issues we take care of, any type of activity is better than no activity at all. So yes, we want you to move just however you can and want to.
Any movement is good movement.
Any movement is good movement.
Absolutely. What role does mental health play in managing diabetes?
It's huge. It's huge. I mean, it's a burden. I mean, I don't blame people. I mean, yes, we see a higher risk of anxiety and depression with people who live with diabetes. I mean, it's a hard disease, and I don't blame people one bit. So, I mean, at that point, talk to your primary provider. Have a mental health provider. It's hard. You need to have your tribe, and you need to have somebody to talk to about it. And if that's not enough and we need to treat for that, we will. Because if you have those problems and they're not treated, then it's going to be harder to treat your diabetes.
A lot of people can feel like I am diabetes. I don't have diabetes, right?
Correct.
Like you just said, it's just such an overwhelming disease that impacts every facet of your life, it seems like.
Yes,
So.
And you are not diabetes. You are not your illness.
Right.
You live with it, and we will help you with that.
There you go. Wonderful. What about medications? Do all people need medicine that have diabetes? What about insulin?
So, most people who live with diabetes will be on some type of medication, depending on what type they have. We do have some people that are diet controlled and don't have to be on medicines because they're using those lifestyle changes to keep their blood sugars down, which is amazing. However, for some people, it's not enough. Just like any other chronic health condition we have medications, and there is a lot of different ones. We have oral medicines. A lot of people hear about metformin is a huge one we use because it is so great at what it does. It helps lower your blood sugars. It helps reduce your insulin resistance, and it actually helps your body use what it has. We have injectables. This is where our friends, the GLPs, come back in. We have Ozempic and Mounjaro, and both of them are also used as well to help with diabetes. And of course, yes, the one that nobody wants is insulin. However, if you are a type 1, you don't have a choice because your body does not produce enough insulin for it to help maintain and lower those blood sugars. I know there's a misnomer. Anybody with type 1 diabetes know they don't make enough insulin, but they will make some insulin off and on. We just don't know when and how. But that's why it's insulin for anyone with type 1 diabetes. It's a life-saving medicine. Without it, they will die.
Right.
You have to have it. And there are people who have type 2 diabetes that we do end up using insulin. Sometimes, if we can't get that A1C down, it's the medicine we use because it's so effective at reducing those blood sugars. And once again, as far as medicines go, it's tailored to the patient. It depends on your wants, your needs, side effects, your other medications you have. So it's not a one-size-fits-all.
Right. How is insulin administered? Is it injectable or how does that work?
So insulin, it can be administered actually in several different ways.
Okay.
So the most common is injectable with multiple injections during a day. Insulin can come in a vial. It can come in a pen. And so we have a lot of people who prefer to do the insulin pens because they're very easy to use. Some people still prefer to use insulin vial because it's cheaper, actually.
Okay.
You can get a vial of insulin at Walmart for $25. And then you just have to use a syringe. I mean, they're teeny tiny little needles, hardly can feel them. Insulin also can be administered through insulin pumps. And we do have a lot of people that choose that route as well because it's giving you a small dose of insulin at all times. That's through an infusion set. We have here in Cass County, we actually have several patients that are on insulin pump therapy, and we have 3 different ones that we work with, and they can be kind of scary, but they're not bad. And then there's actually aerosolized insulin that you can actually inhale through your nose.
Really?
Not used very often, but it is out there.
Interesting.
Yeah.
A couple different ways to get insulin. That's what I wasn't sure about. So continuous glucose monitors are really trendy right now, particularly for people who don't have diabetes. You see a lot of people walking around with those things on. What are your thoughts on continuous glucose monitors, and are they beneficial?
I love them. In the simplest form possible. I absolutely love them. So we do actually have some continuous glucose monitors that do not require prescription to get. Dexcom has come out with one called Stello that you can actually purchase without a prescription to monitor your blood sugars if you're concerned about that. We have people wear continuous glucose monitors if we have concerns for hypoglycemia, so low blood sugars even without the realm of having diabetes, because that's a concern too. The reason why I love them so much is, one, it helps give patients the power back, because you can see in real time what you're doing and what you're eating affects your blood sugars.
Right.
Like that one patient I have who can't eat watermelon. They found out, my blood sugar goes up with watermelon, so I can't have that. So then we trade it out. Or you notice, my blood sugars are trending up. Maybe I should go for a 10-minute walk. I feel it gives patients back something so that they can see what's going on in real time, so that they can do and see that the things that they're trying to do to help lower their blood sugars is really working. For the provider side of it, I love them, one, because I can see trends. So if we see trends of where you're having high blood sugars, we can target those areas specifically. Another big thing is I like to see what people's blood sugars are doing overnight, because that's a huge thing. Because if you have your blood sugars raise overnight, there are things we can do to combat that. All of our insulin pumps use the continuous glucose monitors because it's a closed system. So the pump is giving you insulin. It's attached to your continuous glucose monitor. It can see what your blood sugar is. So then within the algorithm of the pump, it's going to make adjustments to your insulin to help lower those blood sugars. I mean, they're not all created equal. They're not for everybody. The most common ones people see would be Freestyle Libre and Dexcom are our 2 big ones. There actually is an implantable 1-year continuous glucose monitor that goes in underneath your skin. It's called Eversense. It's something that I was just at a diabetes conference in Phoenix this last week, and it's one that I'm going to look into a little bit further that may be beneficial for some of our patients too. So it's a great tool. And just like any technology, its pros and cons, but for me, they're a huge pro. I love them because they can help, like I said, give patients their life back. It gives us more data to help target those specific areas to help lower blood sugars.
Not only is it feedback, but it's like instantaneous feedback. And the fact that you can go back and look at all that stuff is super interesting.
Yep. And on there too, it can show patients what their average blood sugar has been for 7 days, 14 days, 30 days. And it will give them a predictor of what their A1C would be if you would come in. And that's a huge thing for some people too, because they'll say, it's telling me my A1C is 8. Well, I need to change this, this, and this because I want that number lower.
Right. Say, like you said, it helps kind of help them meet their goal of lowering that 3-month A1C, right? Yep. Isn't that how often it is? Okay.
Yep. Every 3 months.
Such awesome tools. Wow, that's super cool. What advice do you have for individuals with diabetes to help them live their best possible life while managing their condition?
Number 1, take a deep breath. You've got this. We've got you. Like I said, it's overwhelming, but you have your primary providers. We have specialists that can help with education. You have your family. Lean on all those people. Don't be afraid to ask questions. We will do what we can to get the tools you need. Unfortunately, with insurance, we have some big barriers sometimes, but we're your biggest advocates to get the things you need, and we want you to do well. We want to help lower those blood sugars to help you be the best you. We're here. You can do it. It's overwhelming. We'll do it one piece at a time, but it's a manageable disease.
It seems like a bear, but with the right tribe and the right people.
Absolutely. And there are tons of resources out there too. I mean, obviously you've got your primary provider, you've got here at Cass Health, we've got all of us know how to treat diabetes. We have me who's had a little bit more experience in getting my certification as a board certified in advanced diabetes management. We've got all of us. I have connections in the cities with different endocrinologists, our diabetic specialists, but there's also lots of resources online for patients too. Like the American Diabetes Association has a ton of stuff. They have recipes, they have tons of patient education, there's booklets. There's so much stuff out there to help people. There's Facebook groups, there's support groups, there's tons of stuff. And if anybody is worried or concerned that they may be at risk for diabetes, ADA actually has a risk assessment tool that you can go to their website, and we can actually post a link to it, and it can tell you if you're at risk for diabetes, and if it shows yes you are, bring it up to your provider and we can start talking about things to help reduce that risk. Like we've talked before with prediabetes, if we can catch this before it starts, we want to delay it as long as possible.
Right. Get out of the danger zone, kind of that middle part, Absolutely. Lower that A1C. There we go. Awesome.
Yeah.
What was your favorite thing that you learned at your conference that you were at? Did you have a favorite highlight while you were there?
So the conference was obviously very interesting. We talked about a lot of stuff. I was probably in the minority as far as a provider goes. A lot of the education was more geared towards nurses and our certified diabetic specialists. However, there was one talk in particular that I would so love to see sometime in the future. It's a insurance company in a different state that they've actually integrated diabetes care and education into their home health system. So we have patients here in Cass County that we do a lot of home health care for. And so this company, they showed us what they did. It was amazing. People who live with diabetes that use home health care, they had people that would go into their homes to help them and educate them to make sure that they were getting the things they needed as far as treatment and education, and making sure that they were up to date on the things they needed to do. It was amazing. And then, of course, the big thing also was the social determinants of health, food insecurity, housing insecurity, money, all that stuff. That was also part of it, too, and being able to hook people up to the resources they need.
Right.
That would be an amazing thing to see happen if we could ever get that.
That home health kind of diabetes integration into that stuff.
Yes.
Like that. Awesome.
That was my big takeaway. That one I was like, man, I really would love to do that.
Right.
Because it would help a ton of people.
Absolutely.
It's a kind of a newer thing, and there's different, like the closest one to us would be like Kaiser Permanente actually has a program. And then the other one was Centerwell, which is nowhere near us, but those were the two big ones. But just seeing it, that it's something they were working on and finally have proof and show, it was amazing.
They could kind of have results to show that that this integration is kind of working and being beneficial to patients.
Yes, it's working. It's beneficial.
Awesome.
It helps people's health. It helps lower their blood sugars, helps lowering their A1Cs. It helps reduce risks and complications. That's always our goal, is to be proactive, not reactive.
Right. Help those people. Kind of a goal for the future around here. Sounds good.
Yes. Someday, I hope. And
Awesome.
It would be amazing.
Right. Thank you so much for joining us for a few episodes here
Absolutely.
About all different types of things. So we'll see what we can drum up here in the future. So.
Alrighty.